The most common medication that our testosterone replacement patients use is testosterone cypionate, typically given once or twice a week. It has a very long half-life and has different dosing schedules individualized for each patient. This is an oil-based injectable medication, so it is a little more difficult to draw up than water-based medications, and may take a little bit longer depending on the size of the needle. We're going to illustrate using a drawing needle versus an injecting needle and show some circumstances where you might just use one for both purposes. To start, you'll remove the cap from this vial, exposing the stopper. This is always cleaned with an alcohol swab prior to drawing up medication. So we have our 1 cc syringe. A typical dose someone might be taking would be about a half a cc or 100 milligrams of testosterone. That will depend on the concentration of the medication as well. It's always very important to understand that. But most testosterone cypionate is 200 milligrams per milliliter. So a half a milliliter is usually 100 milligrams most commonly, but always be aware of what your dose is and what the concentration is of the medication that you're using. So in this instance, we will illustrate using a drawing needle. This is an 18 gauge 1-inch needle. 18 gauge means that it's a pretty wide diameter. This is not something you would want to inject yourself with. It would be very uncomfortable. So we have the needle here. I typically just pop these out of the sterile wrapper that way, exposing the end. This is screwed on. Rest of that syringe is removed. Again, cleaned with an alcohol swab. I'll remove the cap. You can see that's a fairly wide needle. That would hurt. So steadying that with the other hand. Big needle, pretty easy to draw up. However much of that you would like. In this case, we're going to do a half of a milliliter, 100 milligrams, 50 units on these 1 cc insulin syringes. So again, we will remove that needle prior to injecting with a smaller diameter needle. So drawing needle is removed. We have a separate needle here. This is a 25 gauge by 5/8. 27 gauge works fine and is even smaller, but this is going to be much more comfortable. These can be peeled open from their edges. A lot of people will push it out through the paper side, use the packaging, and connect that. So there's our 100 milligrams of testosterone ready to be injected.